first, obviously we did no visits. So for the first 3 weeks, our practice completely changed to visiting all these families, and the area we work in, there's a lot of need. So there was a lot of visits we were doing above and the universal, to just phone in these families, you know, whether that was weekly or at that point was weekly. We were having like obviously plans and safety plans around that, if they had social workers to kind of make sure these children on safeguarding levels that were still protected, bearing in mind they weren't attending school either, so there was no eyes on these children at all. So that was quite stressful from our point of view. So for 3 weeks we were telephone calls, and then it was, we could visit these families, these safeguarding families, and the new births, wasn't it?
Yeah.
So ladies that have just had babies who've had, you know, no family members going round, and, you know, very vulnerable, and lots of mental health. You know, it was, you know, quite difficult.
I think the safeguarding has escalated, and we've had lots of referrals, lots of strategy meetings, which are professional meetings. There's been a lot of mental health issues. I think we've had a couple of family members who've committed suicide within our caseload, domestic abuse, and like Claire said, just not initially doing the visits, but our workload, even though we weren't doing home visits, seemed to escalate in that we, as on the clock, getting lots of text messages, lots of telephone calls, because people couldn't access other services. Lots of WhatsApp pictures of rashes,
because they couldn't get in to see the GPs, could they? These people couldn't get to see the GPs, they couldn't just walk in, so we were the only professionals actually going in and seeing these families.
I think this area as well was, there was a high number of positive cases within sort of the main area we work, and I think there was a lot of concerns around people not socially distancing in this area, and like Claire says, that a lot of services were not doing the face-to-face contacts, and yet we were.
And I think that's been valued by our families, you know, because they've had the chance to get the babies weighed and to just see somebody's face. You know, these women have been having the babies and just having the partners turn up when they're 4 centimetres, and then being sent home, and then not having family members around to come and see the babies once they're born, and that normal thing that you would do. It's I think it's been really stressful. So nice that they can actually, and that's why we've probably had an increase in text messages and phone calls and WhatsApp pictures, and even just to show you the baby and how they're progressing. I think they just wanted that contact. I think as nurses, you just want to, I think it would feel wrong. I think when we went into the lockdown in 3 weeks, although some people obviously were anxious, that thing inside you, you just wanted to do your job, and you felt like you couldn't do it properly over the phone. And even having meetings with the families and on the other end of the phone, it just still doesn't seem right. You know, it's nice to have that face-to-face contact, isn't it?
Yeah.
You see more, and you see what's going on around, and it's just not the same picking up the phone and doing that. You're not getting a full holistic assessment.
And I think some of the nice things, I had someone who walked out of a house, and the appearances, how you sort of perceive someone, and he walked towards me with he had a baseball cap on, and he took his hat off to me and said respect, and
because of NHS?
Yeah.
Like careful.
So that was nice.
Yeah.